you one of the millions of Americans suffering from back pain? There's a new study, and it suggests that you may not be getting the proper treatment after all. It's one of the most common reasons for going to the doctor, back pain. More than 66 million Americans suffer from it. In fact, according to the National Institutes of Health, 8 out of 10 people will have back pain at some point in their lives. By some estimates, patients spend as much as $86 billion each year in search of relief. But buyer beware. A new study in the Journal of the American Medical Association suggests less is more and cautions consumers, be careful what the doctor orders. More often than not, doctors are turning to prescription drugs instead of over-the-counter medicines to treat back pain. But the American College of Physicians says in many cases, prescription drugs are not necessary. Let's get some perspective from Dr. Jordan Metzl. He's a sports medicine specialist at the Hospital for Special Surgery here in New York. He is also the author of the Athlete's Book of Home Remedies. Dr. Metzl, good morning. You're the perfect person to talk to about this. Apparently, this study has a couple of headlines, and one of them is that these narcotics are being overprescribed when something over-the-counter might work for back pain.
Well, that's right. I was really interested, Savannah, to see this study, and that jumped out at me as well, that this kind of issue of narcotics, these are really dangerous medicines, and so we're very careful about giving those, and should be. And people taking these, it's definitely user beware. They're very dangerous medicines.
Let me be devil's advocate, because I think by the time you go actually see a doctor with your back pain, you've tried Advil, you've tried Motrin, you've tried the over-the-counter things, and they haven't worked.
Yeah, I mean, medicine can be part of the equation. So certainly when a nerve in the back gets irritated, it's like a root canal in your back. It kills. I mean, that really hurts a lot. So a short-term course of medicine can help, but there are other things we do with back pain that I think help a lot more.
And the thing about these narcotics, and it's stuff like Vicodin or Percocet or something like that, there's actually some analysis that shows they are not even of that much benefit for back pain. In other words, they don't offer that much relief.
Yeah, I think that's right. I think many of us don't use those very much at all, or just for a very short period of time.
What are the, I guess, dangers or the potential consequences if you do take those heavier medicines?
Well, the main thing is you can get addicted to those medicines, so that's why we don't use them very often. We're much more interested in fixing the causes of back pain rather than, dealing with only the symptoms. So the medicines are helpful for the symptoms, but they don't really fix the cause.
The other big headline to come out of this study is that doctors may be sending patients for high-tech treatments, scans like MRIs or CT scans too commonly. Have you found that? Do you think that's an issue?
Well, I think that actually jumped out at me the most. And you may be surprised to know, Savannah, if we just got an MRI of everybody outside today, about 50% of those people would have a herniated disc and wouldn't even know it in their back or in their neck. So there's a lot of people walking around with bulging discs. And if you have a painful back and you get an MRI, all of a sudden you think that the disc is causing the pain when that might not be the case. And so the tests sometimes give too much information.
As the doctor, though, do you feel that pressure? Here I have this patient who wants a quick fix or at least wants an explanation, or we've got to, turn every stone over.
You bet. People want to come in and want that information as quickly as possible. So my job is, first of all, to fix the pain they're in, and then to try and figure out how we can make their symptoms better. But I think sometimes imaging, like pictures like MRIs, are not always the answer right away. We reserve those for people that have a lot of pain shooting down their legs or things that aren't getting better. But we're real careful to make sure we treat the symptoms by working on their muscles.
And when you order those tests, the healthcare costs just go skyrocketing,
That's
right?
a big part of it. Yeah, that's a big issue as well.
Dr. Jordan Metzl, always good to have you here. Thank you so much.